Very informational. Speaking to Lana, she is also a healthcare practitioner.
Actually, the nightmare started. The whole year, non-stop, different kind of infections. I caught everything on my way. It was upper respiratory infection, it was bronchitis. Maybe 10 months later, I started to walk outside more exercises, physical activities, everything. But then, makes long story short, I'm okay. I found myself in good condition right now.
Hey everyone. So we are back again with another episode of the BioNexus Health Podcast. And today we'll be speaking about Lyme disease, Lyme and co-infections, mold, environmental toxicities, and much more. We will be speaking with the wonderful Lana. She's made a really good recovery from all of the above, and it'll be very informational. Speaking to Lana, she is also a healthcare practitioner, so we'll get a lot of valuable insights and tools to take away from Lana's journey to recovery. So let's go ahead and welcome Lana to today's podcast in a few seconds.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hi, Lana.
Hi, Dr. Dashore.
How are you today? I'm so glad you're here.
Yeah, thank you. Nice to see you as well.
So it's good to see your big smile, and it's been quite the journey with your healing. So can you talk a little bit about your experience? What happened? How did you get ill, and what were your symptoms in the beginning?
My story started just around 4 years ago. Actually, yes, it was April. It's hard to say what triggered my Lyme disease. It was a bite in April. It was a vaccination with the COVID at the same time. So it's hard to say what was the trigger exactly. But I developed a very high fever. It was like 104 around just 2 days. And I went to emergency, and they just, because I had a bite on my shoulder.
Yes.
They did the all test for Lyme, the rainbow tubes. So they all came negative. But anyway, I started antibiotics and went the whole course of antibiotics for this. But after this, so actually the nightmare started. The whole year, it was, non-stop, different kind of infections. I caught everything on my way. It was upper respiratory infection, it was bronchitis, and I was on a few courses of antibiotics. It was summer. And then close to the fall, I developed the very strange rash all over my body.
You had a rash like all over your body.
Especially on my back. Yes, it was kind of very strange. The dermatologist could not say what was the reason. And I developed high sensitivity to different food, especially gluten, and I had different symptoms. I like fatigue, like brain fog, yes, a tiredness all the time, and I did not sleep well. It's blurred vision, especially in the morning. I started my shift at 6 a.m. I just could not see anything on the computer without the glasses. I was so lucky because my coworker who had Lyme as well just recommended to find the Dr. Dashore practice. So I connected.
Oh, that's right, Lana. So
Yeah.
Elizabeth recommended, right? I
Exactly.
remember. That
Yeah,
is
she said, so you probably have a Lyme. I said, no, it was negative. So, okay. She said, so just try to connect to Dr. Dashore. You will know exactly you have it or not. So, and I just make an appointment. It took time to wait, just like 4 months. But I got your book because I just, to make myself ready for treatment. The book is still here. Look at this, how many I still use it.
oh my
Right
goodness.
here.
Yes.
Yes. And so when we met, it was like April 2022, 3 years ago. Yeah. So we started with all possible tests that I remember. It was an environmental test. We just trying to figure out what is bothering me around my place. So I got the company. We did the test, the
The mold.
mold
Yeah,
testing at home. Yes, it was positive. If you species of mold, so I got the remediation company. They did not find anything. I got 2 or 3. And finally, I got it by myself. My basement door was actually with mold. It's walk-out basement. It's
right.
the door, which is
Right.
yeah, in a
So
basement.
wait, Lana,
Yeah,
so you got like two different companies that couldn't find the mold.
they did not find
So I
anything.
guess it is hard sometimes to find the right professionals that can help you. But then
Yeah.
you realized where the mold was on your own.
Yes, I started to inspect by myself because the test
Yes.
was positive. So I have to, I mean, figure out what is the source. So, and we finally replaced the door. The long story short, we replaced the front door and made the storm door to prevent the future any kind of,
Okay.
leakage. So, and after this test came better finally. And then with your recommendations, so I got the air purifier, hospital grade, the Austin company.
Yes. Yeah.
I have a 3-level house, so I have 3 big, huge
You have 3 big
units, yes, on each floor. So, and we just like this part we did. So, and then we started all tests. So with me, it was, I believe, the Lyme disease panel and GI panel with glyphosate, all sensitivity. We found leaky gut I had. So we found all these 3 Bs, Babesia, Bartonella, Borrelia,
Many
abstain.
co-infections, right, Lana?
In
Yes.
co-infections, yes.
Several co-infections.
I was Marcon's positive, and the biofilm developed, and then what else? And we did, heavy metal tests. I had some heavy metal exposures as well. So tons of tests. So the
Fully loaded, Lana.
yeah, but the key was I had a Lyme. And
Right.
yes,
That
and
makes sense. Yes.
yeah, and after this, right away we started the protocol, Dr. Dashore unique protocol. So, yeah, the Dr. Dashore very detailed. So it's just like it was special lifestyle changes. It's a gluten-free, dairy-free, sugar-free. And 3 years ago, I had a crazy sugar cravings. It was like I was dying. I need something sweet. So it was like,
Oh, you're funny.
so yeah. And so we just, and I did the supplement protocol. I believe the supplementation was very helpful in my case to support, my body system, because we just addressed with herbal treatment specifically, we addressed the root causes, right? All the bacteria, antibacterial, antimicrobial, whatever,
Anti-inflammatory.
inflammatory, viral,
All the herbals.
all herbals. And even the herbs can be used for a long time without any concern of harm. And they just can gently remove the biofilm, what was found in my case. But anyway, so the herbal treatment is very potent. That's what I found by myself, because I just add 1 drop, every 5 days. And anyway, I got it. I just I had a feeling so, and all this die-off reaction was kind of significant in my case.
In your case, yes.
Yes, yeah. I just 1 step,
Right.
forward, 1 step back, and then 2 steps forward and then
Little
back.
by little.
Yeah, little by little. So I think it took 1 month for me to be fully on a protocol, and I mean the full protocol of herbal treatment. I was very, very religiously followed the protocol and changed the lifestyle and did everything. So, I think first month was very hard because I had a shortage of breathing. It's kind of probably the die-off reaction affected
Yes.
my heart, and especially the nervous system. That what we did the neurotransmitter test later. We found I'm very low in everything. I mean, just I remember you just asked me, "Are you in depression?" No, looks like no, but actually the mood swings and everything was kind of not good. So, and I have fatigue and tiredness and brown fog, and we did the VCS test, right? The for
For your
vision.
vision.
Yeah, it was positive as well for both eyes.
Yes.
Lyme affected, in my case, vision, nervous system, especially the brain, and the partially muscles and joint. It was kind of on a floating around my body, aching one part and then another part. It's kind of very hard to say what actually is bothering, but very uncomfortable. And I think step by step, we met every 3 months, I think, or 4 months, I don't remember, in the beginning.
Every 4 months.
Yeah, 4 months,
Yeah,
yes. And we adjusted the protocol regarding how I feel. And we just changed the herbal blends and the different supplements to address what problems I do have at the moment of treatment, because everything was changed. And finally, I just remember we did the GI test and no more leaking gut. It was huge success. I just remember
Yes,
that.
your
Yeah.
labs have consistently improved along the way.
Yeah.
So that was, and that's one of the things, because you, in spite of being sensitive, and I know we made sure to customize your protocol to making it fully customized to a sensitive person, not massive doses. It was fine to increase drop by drop every 5 days. And, you started getting better. So I think you're doing really well right now. I mean, you've been discharged. You're doing
Yeah.
really well. So overall, what started improving first, and eventually, I think everything just kind of got better for you.
Mm-hmm. So I think after maybe generally 3 months, step by step, so I get off any die-off reactions, and I was stable. And mostly I had an improvement in my GI systems at first, I can say. And then my strength, the stamina, some kind of I found myself, I was able to do more, and I'm less tired. So I slept very well because with supplementation, all this stuff. So yes, and I mean the night is a lot if you have enough relaxation and sleep. So it's a big deal.
Oh, yes.
Yeah. So I still had I just remember I still had a kind of a stress sensitive. It was the last what just left me. But I mean, the stress was kind of trigger. Any trigger point, I was very kind of reactive, I can say.
Yes.
And it was the last what eliminated. So, and I was
Eliminated. I like that. Eliminated.
yeah, and then I think it was how many, maybe 10 months later, I started to walk outside more exercises, physical activities, everything. But then I had a very the big tragedy in my life. My brother was killed. So, and then just
You were saying something about your brother. He
yeah,
was ill.
yeah, he died, so he was
Oh,
killed.
I'm so sorry.
Yeah, thank you. And this emotional, emotionally, it
Trauma.
was kind of kicked me back. I did not feel again emotionally, mentally. I did not feel well for a few months. But regarding what I had a Lyme. Physically, I was absolutely okay. I did not have any issue. I mean, physically and regarding my GI and any other system. But emotionally, it took time for me to come back to normal.
Absolutely, of course, absolutely.
Yes, yeah, it's a kind of was very. I don't know how to
It
explain.
was very
but
traumatic for you, I'm sure.
traumatic,
Yes.
yes.
Yes, of course.
Thinking now, I think I did well because with what I had before, all my symptoms, actually, I went through pretty well. I mean, I recovered fully in the 6 months. I can say fully. I started to function as normal, absolutely.
Yes.
And so we met again. We just repeated tests and found again something. Still, we did a different test for a Lyme disease panel. We did a blood test the second
Yeah, we
time.
did.
Mhm.
Yes.
So all three B's were there. And so actually all my system worked well. I learned a lot all this time, learning a lot about my body, because each patient is unique, and the Lyme disease is unique in each body. That's what I found, and you have to find your own way how to live this life with this Lyme disease, and how your body functioning with all these co-infections. And most of all, I think we have to address the immune system support. That's what we did with Herbal protocol in the last year, I believe. We just more, I was not supportive treatment,
Yes.
right? Supportive,
Exactly.
and then we stopped for a few months, if you remember, and
I
see
do.
how I go, and then we started a little bit, and right now, makes long story short, I'm okay. I found myself in good condition right now, happy. And even my neurotransmitter, we just did the last 2 months ago, was very low. So I can manage myself.
Right. Yes.
Yes, I have my
Self-regulation.
Supplementation, and I just doing my Herbal less and less and less. The same drops down. My grandson is always with me, and he just brings everything from the kindergarten, all infections. He could be sick. I'm okay. I'm also proud of myself that
Fantastic.
that I can just I can be around my little one and be okay. I don't catch anything. That's what I think the herbal treatment is miracle and a very, very, very good approach. I can say that's a unique approach.
Wonderful.
Yeah.
Your video is frozen, but we can hear you. And I'm glad that you're feeling really well. And it's been wonderful working with you. And yeah, I actually like the way you explained that. In the beginning, we went, we did all the labs and we went all out. You had a full protocol. And then after that, you went on maintenance for about a year. And Lana, that's an important point you mentioned, because you can't just abruptly stop treating, right? Because Lyme disease can resurface. It's important to slowly wean off, get on a maintenance protocol, and then eventually, as your immune system gets stronger, then that you're weaned off and your body is in self-regulation mode. So that is yes.
Yeah, it was a pleasure working with you as well. I learn a lot, and now I can manage myself by myself. Yeah, and with all this information I learned from your book and from our meetings and from our protocols and from my own searching around what Lyme is, etc. So it just different lifestyle you have to have, because I changed. Everything is changed, and you have to kind of accept it that you are different now, and you have to enjoy your life, but you kind of in a more healthy mode to support your immune system.
Overall, the best news is that Lana, you're feeling well, and you've traveled internationally back to your to visit your mom in Russia as well. So will you be able to summarize your journey with Lyme disease, with BioNexus in Russian, perhaps? Briefly summarize.
Yeah, absolutely. В 2021 году, 4 года назад, я обнаружила, что у меня укус клеща. Плюс к этому у меня была вакцинация против ковида. И поднялась очень высокая температура. После температуры 42 2 дня в госпитале мне сделали тесты с подозрением на болезнь Лайма. Болезнь Лайма не обнаружили, все тесты были отрицательные. Но я пропила антибиотики все равно. И после этого целый год все равно проболела. У меня были заболевания верхних дыхательных путей, бесконечные бронхиты. Я была на нескольких курсах антибиотиков. Потом у меня была сыпь по всему телу, особенно на спине. Никто не мог определить, что со мной происходит, пока я не нашла доктора Dashore и ее уникальный подход к лечению болезни Лайма. После того, как мы сделали все тесты, они пришли положительные. У меня все 3 бактерии обнаружились: и Babesia, и Bartonella, и Borrelia. И мы начали лечение. У доктора Dashore уникальный подход. Первое, что она сделала, мы сделали все тесты по поводу плесени и грибков, которые есть в моем доме. И нашли причину, то, что меня раздражало, на что я имела очень сильную реакцию. Все эти сопутствующие инфекции, которые с болезнью Лайма, мы это убрали. И потом доктор Dashore начала свой протокол. Это продолжалось целый год. Мы были на курсах специфических травах, которые выращиваются у нее и делаются в ее лаборатории. Это было и желудочно-кишечный тракт, это было и поддержка иммунной системы, это была иммунная система, это была поддержка сердечной системы. И потихонечку в течение 2 месяцев было очень тяжело, а потом постепенно мне стало лучше, лучше и лучше. И сейчас уже я 2 года нахожусь в ремиссии. Вот. И если у кого-то есть серьезные подозрения на Lyme disease, я очень рекомендую доктор Dashore, ее BioNexus Approach и Biotoxin Illness книжку и ее сайт BioNexus Health для того, чтобы в конце концов взять и справиться с этой инфекцией и жить полную счастливую жизнь и полностью владеть своим телом, не оборачиваясь на разные заболевания. Вот.
Wonderful. Thank you. That was, I love listening to all the different languages because I'm helping patients in 97 countries and all these different cultures and different languages. I just love it.
Yeah. I just I just don't know if I was right in Russian, so I don't practice very often.
Right. But okay, wonderful. So, I can't thank you enough for taking the time today on a Sunday to be here for this recording. And it is going to be very helpful to so many people that watch.
Yeah, I hope this is my kind of
Yes, and
we wish to help people to spread
Yes.
Around the information, then people can find the cure for Lyme. Maybe not completely, but they found the way how they can live with this Lyme, which is in your body, and this is treatable, not completely, but you can manage yourself and can lead the full life.
Oh, yes.
Yeah, that's what.
Yes, it is possible to lead a full life if you have the right approach, the right practitioner, self work on your own self as well. So it needs to be a multi-pronged approach, and it's certainly recoverable.
And I just want to add something.
Sure.
Because in the beginning of when you have Lyme, the brain fog, and
Yes.
you have a condition, you cannot make yourself in a whole. You just kind of scatterish. You just cannot figure out. You just feel you're just a victim and you cannot do anything. And what I found, you just gave me so much support in the beginning and encouraged me to follow your protocol. And this is a teamwork, I can say, because this is you're just very, very supportive for, just lead me through all these difficulties, because it's not easy to go through. But sometimes, especially with my neurotransmitters and my nervous system sensitivity and stress sensitive conditions. So it's very hard to follow the protocol sometimes. You just feel helpless, and your help and support and encourage to help. It worked just excellent in my case, I can say.
Yes, good.
I believe you help many people, and kids and different ages, all different Lyme problem. It's getting more and more now. Just ticks are everywhere.
They are, yes, and I'm so glad you felt supported, because yes, that is something that I try to be sure that I'm always there for patients when they need support, because I've lived it. I've been through it. I've had so many misdiagnoses because the underlying culprit was Lyme and there was mold exposure as well. There was all kinds of labels that were put on it, but the root cause was Lyme disease, and
Exactly.
that is what. So yes, I'm all, and even now you're discharged, but you know that I'm here for you, just like I was before. Anytime
Yeah,
you
yeah.
need the support, I'm there.
Yes, yeah, I remember when we were saying goodbye. He said, "So anytime you can knock to my door."
Yes,
Yeah, yeah, that's a lot. You just feel the support, and you know
yes,
where
I
to
mean it.
go. Yeah, where
Yes.
to go.
Good. Well, again, thank you for being here, and thanks for everyone watching that have joined us for this episode today. I'm hoping that you found a lot of information that you can take away with you. Lana is very knowledgeable. She is a medical healthcare practitioner as well. So the way Lana presents information is very useful to people listening. So I'm glad you were able to join us. Thank you again, Lana.
Thank you so much. Thank you. It was pleasure to see you again.
Namaste.
Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.